that. So I was just wondering if you could share, sort of from your perspective within public health, what the key focuses are in childhood nutrition currently, both nationally, and then whether there's any sort of difference in that locally here in Southampton.
Really, I think it's important to acknowledge the context, with COVID, and we know that's put more families at risk of food insecurity. And the National Diet and Nutrition Survey has noted that households with children are more likely to be food insecure. And when you have a food insecure household, they're more likely to consume a less healthy diet, and that then results in worse health outcomes. So it's really important to acknowledge the context, and COVID has just exacerbated that. And then of course COVID has put a spotlight on excess weight, and this is more in the realm of adulthood, but we know that people who were diagnosed with COVID last year who also had excess weight had worse health outcomes. And that then culminated in one of the outputs from national government was to produce a strategy on obesity for children and adults. But I think in terms of nutritionally, from a public health perspective, the priority has been and continues to be even more important now, about having a nutritionally balanced healthy diet. And broadly, at a population level, that is about eating regular meals, having 5 portions of fruit and vegetables a day, and eating a variety of foods as part of those meals. So starchy foods, starchy carbohydrates, milk and dairy products, sources of protein, and of course staying hydrated. And for children, the priorities are around milk and water. And then of course, last but not least, is reducing our intake of foods that are high in salt, fat and sugar. One of the things that we do know is that children, for example, generally don't meet the requirements for fruit and vegetables. Intake of sugar is higher than the recommended amount for children. So yeah, I would definitely say that's the case. And that's what we need to make an effort to sort of reduce our intake of those foods that are particularly high in fat, sugar and salt.